Hey guys, welcome back again to part two of most common patient presentations. I'm Stacy Hewitt. 13 years of doing acupuncture, 7 years of teaching acupuncture. So let's get started. We'll get started in a minute. Looks like my face is sunburned. That's strange. But anyway, um, one of the things I was thinking about right before I started is to, say, hey guys, you know what? One of the things is I really honor you where you're at. I understand what kind of commitment it takes to go to acupuncture school. I understand that a lot of times we're away from our families, we're away from our friends, away from just life because we have to study, we have to hit the books, and our nose has to be in a book for quite a bit for 4 years. It's not nothing, It's 4 years. It's a long time, and it's a long time to be away from our families and our life. And I know how hard it is, but I just want to throw this out to you. It's like right when you first start, it's like planting a little tiny seed. And then through the years of all of your hard work and vigilance, you water that little seed, right? It's like an imaginary water pot that I'm holding up. I'm not doing some weird thing with my hand, it's the imaginary water pot. And you water that seed, and at the end of the 4 years, that seed starts to grow into this plant. And the plant, the fruits of your labor, finally you're able to see them on the branches of the tree that you planted 4 years previous. And the fruit that you pick and you eat from that tree is so sweet. There's nothing better than to be able to help somebody else. And you guys will be able to do that soon. And that's awesome. I mean, you just don't understand it until you understand it. But you're on a great path. So keep up. Keep your studies up. The fruits of your labor are right within grasp. So keep it up and you'll be awesome. All right. So let's get back to where we were at. So give me a second to get there. And we're going to start with blood deficiency is the first one, or the next thing that we're going to look at. So let me get everything kind of set up. So give me just a second. And okay, come on, where is my slideshow? There we go. Slideshow. And oh no, not from beginning. Oh well. All right, hold on, give me a second. Let's just go through all these wonderful things. Punch and Judy. There we go. All right, let me move this back to the top. Once again, like I said, these pictures are trying to be brain mnemonics for you too. I mean, you're not going to see somebody that looks like a vampire coming in your office unless it's Halloween, but you will see people that are pale, and that's one of the telltale signs for blood acuity or blood deficiency. So here's some other signs of blood deficiency: dry skin conditions where the skin is dry. Dry skin, dry hair, brittle nails, brittle hair. My hair breaks all the time. My hair's dry. It's more. You'll see people say more about their hair breaking and being brittle. Their nails are brittle. Night blindness, and when I say night blindness, it's not like you cannot absolutely see at night. It's more of a thing where it's harder to see signs at night because of either it kind of reflects and you can't see, or you just can't see the signs as well. And sometimes the reason that night blindness is here is sometimes you'll ask people, they got glasses on, and you'll say, hey, how is your eyesight? Oh, my eyesight's fine. Well, why you got glasses on if your eyesight's fine? But you're trying to think of things that are involved with the liver, and you'll say, "Oh, the liver's involved with the eyes. How's your eyesight?" "Oh, it's fine." But then, if you pinpoint things about night, how's your can you see signs easily at night? How is your night vision? Oh, it's not that good. People will people understand that better and won't say a snap decision of, "Oh, my eyesight's fine." when they're wearing glasses, but ask them about, can you see well at night? Can you see the signs? And then, and more so, can you see not? Can you see signs easily at night? Because if you say, "How's your night vision?" they'll be like, "Oh, I'm fine. I'm fine." And then they'll bump into the door. They can't find how to get out because they can't see. And they'll be like, "Oh, my sight's perfect." But anyway, ask them about how well they see at night or the signs at night. Pale or white, or sallow yellow facial complexion. More, it's going to be, I haven't seen too many yellow people, but occasionally you will. But definitely the very pale look. And fatigue, blood deficiency, spleen chi deficiency is inherent in blood deficiency. So that's where that fatigue is coming from. Pale tongue, a very fine, thin, like thread pulse almost, and poor memory. It's like, "Oh, I can't remember anything." That's another part of blood deficiency, or I have a mental fog. Sometimes people will say that, but it's poor memory. So blood deficiency, the main points: stomach 36 and spleen 6. Those are really great blood building points. I have seen a lot of different protocols for building blood. Crazy stuff. I remember I used to really love studying Jeffrey Yuen when I was in school, and there was a blood building protocol that he had where it was like heart one was part of it. Nobody wants to get needled in their armpit. No patient does. You can be Mr. Fancy Pants all you want, but no one likes you fishing around their armpit, putting a needle in there. And spleen 6, stomach 36 is a really great point combination. For building blood, it's easy to access, and people don't mind it. Bladder 17. Why am I doing bladder 17? That's another quintessential point that you see when there's blood issues going on. Is the back shew of the diaphragm, but the Chinese would think of the bellowing aspect of the diaphragm being kind of a pumping aspect that could further pump blood through the body, not taking the place of the heart. That's not what I'm saying. It's just that bellowing action helps pump the blood a little, helps pump the blood through the body, or that's what they thought. It's not taking the place of the heart because they thought the heart was involved with that, but the bellowing aspect of the diaphragm can assist. That would be a good way to look at it. So that's why bladder 17 is quite often seen in any kind of blood building or blood stagnation, blood moving protocols. Bladder 20, actually the spleen, the main source of creating blood. Spleen. Bladder 21 is the back shew of the kidney. Once again, it's hand in glove, like we were talking about last video, or in part one of this. The stomach and spleen work hand in hand, so that's going to further assist the blood building. And then CV12 further strengthens the spleen. And here's a link right here. You can take a picture of this or to grab this link, but Giovanni Machochi, or Machiocha, sorry, it's getting near the end of the day. Giovanni Machiocha has a really great article about blood deficiency. So I put that in here too. Yeah, I really like that article. Oh, I love this one. Heart spleen dual vacuity. That means it's a heart and spleen dual deficiency. And this is very common. And I love this where it says, "I went to the doctor for fatigue and forgetfulness, and I was diagnosed with motherhood." It's so true. Because a lot of mothers that you see they will have these symptoms. Why? Because when you give birth, we've talked about this in previous videos, but when a person gives birth, they lose a lot of organic fluids, they lose a lot of blood, and they can be a little low in those afterwards. And these signs of heart and well, it's really going to be more of the blood is deficient, so it's going to start causing this. It's like the spleen is weak. There's not that much blood, and then the heart is going to start heating up, kind of like the liver in a way. But it's less about heating up. It's more about not having the grounding element of the blood to keep the shin comfortable and where it needs to be. And we'll talk about that in a second. But this is a very common pattern. If a person comes in with this and it's a female, you can ask her, and she's young, ask her when these things start happening and see if they don't start correlating around a childbirth. Not always. It's not 100%, and that's not the only way that you get this. I'm just saying it's common. But like I said, it's not the only way. Guys can have this. You can get this post surgery sometimes as well. But you can have not childbirth. You can have neither childbirth nor surgery and still have this. But let's look at it a little bit closer. So, some of the other signs are fatigue. What did we talk about fatigue? With earlier spleen chi deficiency, which spleen chi deficiency is inherent in blood deficiency. Heart palpitations. Once again, the heart's not doesn't have that grounding element that the blood provides. So you'll start to see sometimes erratic heartbeats, or sometimes you'll see what the Chinese would say, where the heart beats uncomfortably in the chest. So you notice it. Meaning it's not like, oh, my heart's beating around like, beating like crazy or irregular. As sometimes they would say is when the heart would beat, but you notice it beating, and that's uncomfortable for you. So it's a little bit of a difference. But anyway, heart palpitations. Insomnia is a big thing with this pattern. I caught myself saying, I need to have a penny jar, and every time I say, I put the penny in there. But insomnia, we talked about that in part 1 of this video, where you want to find out if they wake up. Do they have problems falling asleep or staying asleep, or both? Falling asleep sometimes has to do with more of the liver. You're like young and overworking yourself. You're too busy. You're not turning your electronics off when you should. And you're thinking about work, or not thinking about work. You just have been busy and been rushing around the whole day. And it's hard for your body to adjust and calm down, or to relax. Basically, it's hard for your body to make a shift from the sympathetic to the parasympathetic system. That transitional piece, right, that we talked about with the liver prior, when you're caught in transition where you're stuck in that transition. So that's falling asleep. But staying asleep, that's when you need to ask that question. When you wake up, is it when you wake up and then you start thinking about things, or you wake up and it's like nobody's home but the lights are on? That's more of the heart. Nobody's home and the lights are on. And then the heart's also involved with when people feel like they are asleep and they're not really asleep, where they feel like they're vacillating. They're not awake, but they're not asleep, or they're a light sleeper. A lot of times that the heart has something to do with that. But a lot of times when you look at that, say the heart has something to do with that, it's because the blood is deficient and the blood's not grounding the heart. The heart, I joke with students and say, the heart, the Chinese talk about how that's where the emotions go back in at night to reside. And I kind of like the analogy of it's like a nest that a little bird goes back to roost in. And if the nest is nice and well maintained, nice and fluffy, then the bird wants to go back to its little nest. But if it's a crappy nest that looks like it's half fallen apart and all dried up and brittle, nobody wants to go back to that nest, and that bird doesn't want to go back to that nest. And then it's going to fly around all night inside and keep you awake. Well, the blood is what really makes that nest supple and moist and comfortable. And when we're blood deficient, suddenly the nest starts to become gross and dry and brittle, and the bird the shin's not want to come doesn't want to come back and roost there. It's just going to flutter around all night and keep people awake. So that's the way to look at insomnia, or an analogy. Poor memory, we've talked about that before. It's not the same as someone who's very elderly and they have poor memory. That's a little different. there is there are studies that talk about how um another penny. Oh my gosh, another one. But there are studies that talk about how blood stagnation can, or a blood deficiency can be part of some of the cognitive functions that elderly people start to the cognitive functions that start to diminish in elderly people. Plus, think about a lot of elderly folks you look at, and they are pale as ghosts. Blood deficiency there. But those studies that talk about blood being involved with the brain, they'll talk about a lot of herbal strategies of really exciting the circulation in the brain to help rejuvenate that. It's not just the energetic component of the kidneys, and the marrow disappearing. So, like I said, a lot of the memory that we commonly associate with the kidneys, the brain is the sea of marrow. A lot of those issues, marrow issues, kidney issues with memory, that's not what we're talking about. It's more like I always forget where I put my keys, something like that. So once again, it's talking about a swollen tongue with teeth marks on the edge. We've talked about that swollen tongue, right? You should know a swollen tongue now with teeth marks, what that means and what it looks like. It's spleen qi deficiency. So how do we treat this? The main points: bladder 15, back shu of the heart; bladder 20, back shu of the spleen; bladder 17, we just talked about the bellowing effect of the diaphragm; stomach 36, spleen 6, those are blood building points; heart 7. Food stagnation. It's very funny about this. I came very close to taking this out years ago, and I guess out of laziness, I just didn't. Because very rarely would I have a patient come in because they have food stagnation. But just as of late, I had someone come in, and the symptoms of food stagnation they had to the T, to the T. And it's interesting because a lot of the times for food stagnation, we think of somebody overeating, overindulging. I ate all that food that you see in this picture and drank all that beer. And sure, it was good going down, but now my stomach hurts because I ate too much. I feel like I have food just hanging out in my stomach. That's what food stagnation is. And a lot of times I tell, students will come in and I'll tell them, it's like people don't commonly, there's certain patterns that you see that people aren't going to pay you money, because nobody's going to pay me a bunch of money to come in and see me because they ate too much. But every once in a while, I've just had one person that recently who they weren't eating too much, but they were exhibiting a lot of food stagnation symptoms, and that's how I'm having to treat them, and it's helping. But let's get into this. So this is another reason I didn't. I was thinking I'm going to take this food stagnation thing out of here because you always hear about people with food stagnation have bad breath. And it's because of the food is really sitting down there in their stomach and rotting, right? It's ripening, rotting and ripening as the are supposed to be the stomach's actions. But they get all of these fumes from food sticking around. But I've had people that come in and they talk about they have bad breath and they want to try to work on that. And I've tried to work on that a tremendous amount with stomach heat or food stagnation. And I just really can't make a change in that. And it's a little bit of a drag, but there's not that many people that come in for that. But I've really not had a lot of success with that. But these are the things: slimy tongue fur, and and you've got to think about this too. Like I said, it's maybe in this lecture, I think in part one, but you you're just not going to see that many people come in. But not saying don't pay attention to this pattern and don't learn it because you need to know it for your board exams, and you should know it. You just should know it, but you're not going to see that many people. I mean, I've had one in 13 years. I mean, I've had a couple of other ones that have had minor food stagnation, but textbook case only one. Possible reduced desire to eat and abdominal fullness. Those were the big signs that I had with the person recently. She would talk about how she she went to a seafood buffet and she loves crab legs. And she had like two crab legs. And then she said, I was almost crying because I had my abdominal, had abdominal fullness. My stomach was way full and I could barely eat. And I had hardly eaten. My child that was 5 had eaten more food than I had. And I could only eat a little bit. My desire to eat had been reduced. So it's food stagnation, and we're treating her for that. And um, we'll see how that works out. I think it's helping, but I haven't seen her in a few weeks because there's some other strategies too that we will look at that I'm not going to get into right now. But from the emails that because I've emailed her to just find out how things are going, and it seems like it's things are going in a good direction. So here are some of the points for food stagnation. Stomach 25, we talked about that. It's a good local point for that abdominal fullness. Stomach 21 is the same thing. CV12 helps it's in the same area, but also it helps strengthen the earth phase, the spleen, and the stomach. Stomach 36 is the same thing. Stomach 44 is there to in case there's heat generated from that food just sitting there and being stagnant. Large intestine 4, headaches. Sometimes people will overindulge and get headaches from that food stagnation. PC6 for burping and belching. It harmonizes the stomach. And LI11 for heat. So there you go for food stagnation. Stomach heat. Now, stomach heat's opposite of the last thing we saw because look at this. Large appetite with rapid hungering. If you're not a teenager and you're like ravenous all the time, then there might be a stomach heat issue going on. There's too much heat in the stomach, so it's just making the stomach feel like it needs more food to try to settle some of that fire down. So red blemishes along the course of the Yangming in the face, not quite, I wouldn't say rosacea, so to speak, but acne, things of that nature. Bad breath. Once again, guys, I have tried stomach heat and I just haven't been able to make a dent with the bad breath stuff. Bleeding gums. That's another sign of stomach heat. Thirst for cold drinks, trying to put the heat out. Burning sensation in the epigastrium, burning sensation in the stomach. Nausea, vomiting after eating. Sour regurgitation. Sometimes with stomach heat, you hear about stomach acid or GERD or things of that nature. So if you're not seeing a lot of liver signs, then you can look at the stomach heat. Yellow fur on the tongue means there's a yellow coating on the tongue, and it's not like a fur coat, but there's you can see a yellow coating. So here are some points. Stomach 21, it helps clear stomach heat, makes the stomach chi descend because that nausea is rebellious stomach chi. Ren 13, once again, subdues that stomach chi because you have that rebellious stomach chi. The stomach's trying to, as the chi's moving up, that's where you get that nausea. Stomach 44 helps clear heat. Stomach 45 helps clear some more stomach heat and calms the mind. Spleen 6 is just helping the whole earth phase in general. CV12 or Ren 12, once again, is helping that whole earth phase. Also, it's helping clear some of that stomach heat. Pericardium 6 helps subdue some of that rebellious chi coming up with some of we saw that with the last two slides ago. It helps with hiccups, helps some of that rebellious stomach chi, can calm the shin. If sometimes stomach heat they'll talk about will make people a little erratic, but typically if I have a patient that is having some emotional distress, stomach heat's not the first place I look. Just saying. And here's another slide that I added in stomach and intestinal heat. And we are not, Chinese medicine is not about Western disease names and Chinese or acupuncture points. It's not Western disease, the Chinese acupuncture points. But all I'm saying is this presentation can be very similar to what you see in ulcerative colitis with people because of the mucus in the stools and the blood in the stools. That's a very common thing for ulcerative colitis. There might be some other treatments that you could do for that, but this is a good, if you have a person that comes in with something like that, this is a good starting point. It's solid. You're not going to make their chi run backwards or anything with any of these protocols or starting points that I've showed you. And what I was talking about, chi running backwards, I had a class one time that I took with this guy, and he was like, "Oh, well, if you do this, then you'll make the patient's chi run backwards." And we're like, "Really? How do you know if it's running backwards?" And he couldn't tell you. And then we asked him more questions about this chi running backwards, and he couldn't tell you. So in the end, he didn't know what he was talking about. He just made that up. People's chi doesn't run backwards. They have rebellious chi, but you're not going to make their chi run backwards. You're not going to break them. So don't worry about that. But this pattern, more importantly, the stomach and intestinal heat is you have diarrhea with dark or bright stools. Is more, I would think, dark, foul because of potential blood in the stool. Because when we have blood in the stool, it will turn dark. It's not like it's going to turn your poop red. It's not like you're going to have a red poop. You could have some blood in the toilet water or on the toilet paper, but it's not like you're going to have a, bright red poop fallout. Let's hope not. Burning around the anus with or after defecation. Sometimes this heat will generate some dampness, which will cause some of that itchy anus. Slimy yellow fur in the back. So some points that could be good: stomach 44, large intestine 11. Both of those are heat clearing. Spleen 9, which is a good point for dampness. Stomach 25, CV12, trying to help bring chi into that abdominal area. CV3 is doing the same thing. Bladder 25 is the large intestine back shoe. Spleen 10 helps with bloody stools or gums. Spleen 5 and stomach 40 and bladder 20 for the mucus in the stools. Bladder 20 is for helping that spleen deal with dampness. Stomach 40 is a phlegm point. Spleen 5 is for dampness. So, like I said, that's a good starting point in case you see somebody that comes in with this. Kidney yin deficiency or vacuity. I've got this picture here because a lot of times you'll see with kidney yin deficiency some empty heat symptoms, which are basically menopausal symptoms. So let's look at this. So deficiency in the yin can cause empty heat. Oh, what? That's what I was just saying. Hot palms or soles, also known as the 5-palm heat. My hands get hot, my feet get hot, my chest. That was the 5th palm. That's what the Chinese would consider to be the 5th palm. 5-palm heat. 2 palms, 2 feet, chest getting hot. Malar flush, redness of the face. And then, which is a little different than rosacea, which has more to do. I know I was just thinking, I know a few slides back I was talking about stomach heat and saying not quite rosacea, but the rosacea would be more yang ming, something going on with the yang ming. Doesn't mean that it's just the stomach has fire in it and that's causing the rosacea, but it's more yang ming related. Whereas this malar flush is more like things that you see with kind of like the butterfly rashes that you'll see on people sometimes with autoimmune issues, things of that nature. Red cheekbones, once again, kind of like that butterfly thing that you see with some autoimmune conditions like lupus. And then night sweats, afternoon fever. And what I'm talking about, afternoon fever, is different than having the flu. But even though sometimes it's interesting when you do have the flu, you feel worse more in the afternoon. But it's more like you'll have people that will become more warm, not like, oh my God, I've got a fever, but just a little bit of a fever, not fever, but warmth in the afternoon. I had a patient just recently. There's a thing where they always talk about, say, with stomach fire, it's like you want to drink gallons of water. With this type of heat, you just want little sips of water. And for years, I would ask that, do you get thirsty in the afternoon? Do you feel like you would need to drink little small sips? And no one would ever say, nah, I don't notice that. And I just had a patient recently who, after 13 years, it's like, I always have to have water when I go to bed at night. I have to drink it all through the night. And that is kidney deficiency. Constipation, dark urine, thirst. Those are the system is our internal system is becoming inefficient, so things are drying up. That's what yin deficiency is all about. The afternoon fever, one of the things I was watching this movie recently and it had this guy and he had tuberculosis. And tuberculosis isn't something, thank goodness, we see commonly now. But this was like back in the 1800s. And you'd see him and he would be sitting around sweating all the time. And that's an example of what they're talking about, this afternoon fever. It's not like he necessarily had a fever per se from the flu, but it was like some kind of disease that's going on that is burning up our yin inside our body, and we're just sweating it out. So, so another thing with kidney yin deficiency would be soreness of the knees or lumbar region. That's a common just kidney sign. Kidney of the brain, tinnitus. Some of the times people will start getting tinnitus with kidney yin deficiency or a kidney deficiency in general. But when you look at tinnitus, you think, is it high pitched or low pitched? High pitched is usually involved with stress, involved with the liver. Low pitch has more to do with the kidneys. Poor memory. This is going to be more of the sea of marrow stuff, like you will see maybe with people later in life. Dizziness. Sometimes when people have more extreme kidney deficiencies, they will get some dizziness. Meaning, our kidneys are our energetic 401k, meaning when the yin circulates around the body, goes to each organ, and each organ grabs what it needs off of there, and anything that's left over goes to the kidneys and gets stored there. And that's our energetic 401k. That's the energy that we use when we're burning the candles on both ends, right? Or we're overworking. We start tapping into that 401k. And then when we get to really an extreme of deficiency, then we can start getting some of this dizziness because our body's energetically exhausted. Other potential kidney yin deficiency things would be sexual dysfunction, such as premature ejaculation and nocturnal emission. And this is meaning more for people who these things aren't age appropriate for. Like you're going to have nocturnal emissions when you're a teenager, just part of life. But this is more of like when you're an older, not an elderly person, but when you're past your teenage years and you start seeing this. And especially with dreams, that's because a lot of times with as your kidney yin becomes deficient, then the mother stops nourishing the child, meaning the mother stops providing for the liver quite as much. And vivid dreams are the liver. And we'll get into that later. Well, we'll get into that now because I was thinking of a different lecture that I have and that talks about that. But the liver is involved with the hun, which is the spirit of the hun. And a lot of times when the liver is restless, they talk about the hun goes in and out of the body at night. And when it's really restless, it just goes in and out of the body a lot. And I know that sounds a little new agey, but this is Chinese medicine. I didn't make this up. And the more agitated or movement that happens with the spirit, the hun at night, the more disturbed our dreams become. And I'm not talking about nightmares. It could be like our dreams feel very active to us and they become more vivid. And sometimes we're not able to rest as well. So that's another sign of, and I should have put that in with the very beginning with liver qi stagnation, because if somebody's liver qi is off, they can have very vivid or dream disturbed sleep. Just FYI. So with kidney yin deficiency, So when the kidneys are not nourishing the liver, then the liver maybe can have some very restless dreams, and that's why this last slide mentioned nocturnal emissions, especially with dreams. So the main points for kidney yin deficiency or vacuity is the main points are bladder 23, kidney 10, which is the back shoe of the kidneys, right? Kidney 10, kidney 6, which kidney 6 is the big kidney yin point. Kidney 3, yuan point. Kidney 10 is a Hosi point, it's a water point. Spleen 6, three-leg yin, right? CV4, that's another point that strengthens the kidney energetics. Kidney gong deficiency. So chills and aversion to cold, cold limbs, apathy, lethargy, loose teeth, and deafness. Chills and aversion to cold, that is the legendary battle between husband and wife over the thermostat. It's like the especially in their later years, the wife wants to turn the air up because they're getting a lot of those empty heat symptoms. They're getting warm. And the man wants to turn the air down because their yang is diminishing and they're feeling more cold. So it's kidney, that's one of the big things with kidney yang deficiency. That whole cold limbs. The apathy, think about apathy is kind of the opposite of motivation. We start losing our motivation. So I don't care, whatever. Lethargy, we're starting to lose that oomph from the kidney yang, the drive, the motivation. I'm I don't care. I'm kind of lethargic. I'm moving like a sloth. That's not what the kidneys are about. It's to move forward with direction, being direct, not moving around like a sloth. Deafness, kidneys control the ears, so you know, you see that quite often as people get in their later years. Low sex drive, impotence, frigidity. Um, it's like, what is it? Young dogs want to run around the yard. Old dogs just want to lay on the porch. So that's kind of like the low sex drive, I guess. Impotence, the same thing. It's like kidneys are part of what gives um, the ability to have an erection. Frigidity, this is interesting. I took a class one time and I was just trying to think if this went out, if there was another slide that goes into this, but no. Well, I took a class one time. It was really interesting. It's like they were talking about frigidity. Was it really kidney yang, or was it interest? Meaning, like when you don't have a lot of kidney energy, you might not feel like getting it on. You might not have the energy or the sex drive. That's our kidney yang is our sex drive, so to speak. You know, and they were like, one of the things that if somebody comes in about this, about low sex drive or frigidity, it's like, is it really kidney yang or interest? Meaning it's like maybe they have lost interest in their partner, which is, it happens, it's life, sad, but it's life. So they were like, do they exhibit a lot of these other kidney signs? Or if you ask them, is it like you're too tired to do it? Or if they were like, this was something this is for women. It was like, is it like you're just too exhausted to have sex? Or if Brad Pitt came in the room, would you want to have sex? I mean, or whoever, it doesn't matter. If Brad Pitt's not your thing, it doesn't matter. For a guy, it's like if it's Pamela Anderson comes in the room, would you be interested in having sex? Like I said, I don't know. I'm just coming off the top of my head. But so it's more about, is it, do you not have drive or do you not have interest? So that's an interesting way to look at it. Don't know if you need to, quiz every person to see if they want to get it on with their, if it's an 80-year-old patient. And I got in trouble about this a little bit ago because somebody got on my case and it's like, 80-year-old people want to be having sex too, and more power to them. I hope so. But uh, but if it's an 80-year-old person that maybe has a more conservative background, there's probably better ways to find out through other symptomatology if they have kidney yin or kidney yang deficiency than asking them if they're ready to get it on all the time. You know, that's because my whole thing is to make people feel comfortable. I don't want to embarrass anybody. And if I can figure out that you have a kidney yang deficiency, I don't need to ask if if you're impotent and you're 90 years old. I need to ask if you're getting it on and you're an 85-year-old single lady. I don't, because I can figure it out without that information. But on the other hand, and I'm not approved, I'm not approved. But on the other hand, if somebody wants to talk to me about that, then I remember that's important to them, and we need to address that. And I don't mind talking to a 87-year-old woman about her sex drive, or a 75-year-old man about his impotence. I don't. That doesn't bother me. But I don't, like I said, I don't feel like I have to ask people where later in life some of these qualities will have diminished. I don't need to ask about their sex life because I can figure things out without that. But I had one person that was like all about, sexual activity of elderly people and venereal diseases and stuff like that. And more power to those folks. More power to those folks. Um, Kidney area. So once again, we see some of this. Oh, hold on. So low sex drive, sterility, and spermatoria. So once again, these are all sexual functions and sexual of kidney young. Kidney areas, the soreness in the low back, in the knees, the lumbar region, the coldness, the weakness and cold of the knees. The knees don't necessarily have to be cold for kidney young deficiency, but as the coldness, if you're deficient in yang, then more than likely you're going to be cold. But doesn't mean that they if their knees are weak or bad and they're not cold, they're not kidney yang deficient. Doesn't mean that. But you want to see other signs of coldness or apathy, lethargy, things of that nature. You want to see some other signs before you say, oh, that's kidney yang deficiency. Um, Kidney yang fails to hold fluids. Copious clear urine, having to go to the bathroom a lot. And if sometimes I'll ask people, is your urine, do you feel like your urine intake is equates to your urine output? Meaning, do you feel like you pee more than you drink? So that's what they're talking about there. Frequent urination or incontinence, nocturia. So that is definitely a sign of kidney yang deficiency, but also if it's a male, you want to find out about the prostate too, because enlarged prostates can cause some of these same symptoms in males. And sure, you could say, well, that is, some of that could be kidney yang deficiency, but when a male has an enlarged prostate, there's a structural component to that that will cause some of these symptoms. So don't let that fool you. Don't let that fool you. So kidney yang fails to circulate fluids. Sometimes people will have the opposite, where they're not urinating that much, and they're having edema. Our kidney yang fails to warm the spleen. That means it's loose stools. And this is interesting too, especially in the early AM. It's called in Chinese medicine cock's crow diarrhea. And I have um, I have seen that I was staying in a house with some elderly people when I was taking a class, and like like clockwork, the early morning thing, everybody's got to go in the bathroom and poop. And that's cock's crow diarrhea. And I mean, it wasn't like they were in there. I mean, I'm not trying to be like listening in on what your bowel movements activities are like, but they were right next to my room, so it's just like you could just hear them, and it wasn't like they were in there having healthy sounding poops. Sounded like amazing diarrhea going on, and it was in the morning. It was cock's crow diarrhea example. Now here's another thing too, and I've talked about this in previous lectures, but kidneys failing to grasp the lung chi, to grab it and pull the air down. That could be a big thing with asthma. That's when you see people with inhalers. Inhalers are just bottled kidney yang. Those steroids, that's what they are. So they help pull the air down in their lungs. So when people have exercise induced asthma, sometimes that has to do with kidney yang not grasping the air and pulling it down. So that's what they're talking about here. So points, basic points: kidney 3, CV 4, Moxus bladder 23. That's the back shoe of the kidneys. Bladder 52. That's another strong point for the kidneys, especially kidney yang. And then GV4, right? Ming Men, bam, lots of that too if you can. But those are all about warming up the kidneys. Here we go. We were just talking about this spleen and kidney yang vacuity or deficiency, right? This abdominal pain that's aggravated by cold. So asking your patients, hey, does a heating pad help that feel any better? That's one sign for this. Aching heaviness of the extremities. We've talked about this earlier in part 1, where you have heaviness of the extremities from spleen chi deficiency. When the spleen is not extracting out the nutritive or the nutrients from our food, so it makes us weak, makes our extremities feel heavy, especially if you start getting some dampness in there, then they'll really start feeling heavy. Oh, look at this, the next thing, generalized edema. If in the lower limbs, think more about the kidneys, but that's generalized edema everywhere. Lower limbs really are a lot of times when you look at people's ankles, you think about the kidneys energetically. A lot of times you'll look at, and in Western medicine, you'll think about the heart with edema sometimes, especially around the kidneys, but in Chinese medicine, energetically, the ankles. Loose stools, well, you have spleen issues going on, so you're going to have some diarrhea. Dizziness, once again, we talked about that where the kidney energy is becoming deficient. 401k is running out, so you get some of that dizziness. And then when you compound it with some of the dampness coming from the spleen going up into the head too, that also causes dampness as well. Some heart palpitations, a little bit different from the ones that we saw before with the heart palpitations. This is more about sometimes when the body doesn't have enough energy, kidney energy, you'll get these. And what I mean, that's kind of dumb because Stacey, we're talking about kidney energy and you're saying it doesn't have enough energy and blah blah blah. But what I'm saying is When once again, when we start getting a little low in that energetic 401k, then our heart will start to palpate. Meaning, it's like when if you've ever been really fatigued before and you start getting heart pounding or heart palpitations, it's the same thing. It's like our body's just becoming fatigued because we don't have as much kidney yang energy there to keep away just to feel vital. That's the best way to look at it. It's like our kidney yang gives us this feeling of vitality. And when we stop getting that vitality, we start getting more palpitations. Coughing is coming from like some of that dampness from the spleen. Vomiting, once again, it's dampness building up. Heavy-headed sensation. So what I mean by this is when you have dampness, you'll sometimes have this. You can ask when patients have dampness, you can ask them, does it feel like you've got a damp towel wrapped around your head? Does your head feel heavy like that? And if they say yes, then that means there's dampness up there. That wet, that heavy wet towel feeling. Once again, the polyuria, nocturia, meaning urinating frequently at night. That's a kidney thing. We just saw that in the previous presentation. And it's okay if somebody, once you get past being a teenager or a young 20-year-old, it's okay for folks to get up maybe once a night. But if they're getting up like 8 or 9 times a night, 5 or 6 times, that's nocturia. Once again, check to make sure they don't have prostate issues because that can contribute to some of the nocturia that's not 100% energetically related because it's structure. Low back and knee soreness, weakness, kidneys, and diarrhea in the morning. That's the second time we've said that about this pattern, but that is a big thing. Coxcrow diarrhea. Main points. So you can do bladder 20, bladder 23. Moxa is if cold is prevalent. Remember me talking about, does a heating pad on your stomach make it feel better? CV4 for the kidneys, CV6 for some of that abdominal discomfort, CV12, stomach 36, both of those are helping with the earth phase and the digestion. Kidney 3, if there's prevalent kidney signs. Kidney 7, if there's respiratory signs. Spleen 3, if heaviness of the head. You remember that dampness of the head we were just talking about? CV12, you can moxa CV12 was again if that abdominal area is very cold, or if the heating pad feels good to them. Liver blood and kidney yin deficiency or vacuity. Basically, this is a combination of what we've seen before with the liver and the kidneys. So we've got the vision, tremors and contractions of the sinew. Once again, wind, when the muscles aren't being lubricated by the blood, and then the liver is not being lubricated, you'll start getting some wind. It's more of the liver not getting lubricated. The sinews need to have the blood to provide suppleness to them. But when they start to get that wind, those tremors, those shakes, those ticks, that's the liver. It's less the sinew. I apologize for saying that. Numbness of the limbs, you'll see that sometimes with liver blood deficiency. Brittle nails, rib side pain. Menstruation is early, basically irregular because of, remember us talking about how the liver is involved with the distribution of blood. And then sometimes if the liver's not happy, then the menstrual cycle is off because of the distribution of blood is off. scanty menstruation. There's if you're short on blood, then your period may be light. Painful menstruation. We've talked about that before too. I'll always check about clots because clots will say a lot about if there's blood stagnation going on as well in that area. So some of the kidney signs we've already said: 5 heart heat, hands, chest, feet, insomnia, restless sleep, tidal fever. Tidal fever is the same thing of feeling a little hot in the afternoon. Flushed cheeks in the afternoon, dry mouth because of that yin deficiency. Yin deficiency is dryness when you don't have enough yin. Night sweats, that's the empty heat. Dizziness, we've talked about the dizziness before. And main causes: overtaxation, that means burning the candle at both ends for too long. Also, prolonged disease is if you've been sick for a long time, that's tapping into your 401k, your energetic 401k, because the 401k, energetic 401k, is really about trying to prop our body up. Our body sometimes when we need to be propped up a little bit because things are off, we'll draw energy from that 401k as boards. Have you ever seen pictures of people putting boards up to hold their ceiling up, 2x4s, sticking them up in the air, crossing them over to make sure their ceiling doesn't collapse? Or they're in a cave in a movie and they're ramming wooden ties up underneath the ledges to keep the ceiling from collapsing. That's kind of what our 401k does. I mean, our energetic 401k does. It provides that, it bolsters our supports to keep them from collapsing. But once we don't have as much, then things start going awry. So that's prolonged diseases. They tap our 401k because we're trying to provide support for areas that are collapsing from disease or also age. Once you start getting older, your organs are just not as efficient as they were when they were 20. So you need more support for them to function. For sometimes they can't metabolize or grasp different pieces of yin chi as it passes by as well as they could when they were 20. So they don't function as optimally and they need somebody else to come in and help them do their job. There's jobs that we could do by ourselves when we were 20 that when we get to be 70, maybe we need somebody else to help us with that same job, to help us get it done by the end of the day. Then once again, the pulse could be fine and string-like, and there might be some rapidity in it. It might be fast because there's some of that empty heat going on. Here are some points for that. Bladder 18, which is the back sheet of the liver. Bladder 17, we've talked about that diaphragm. Liver 8, spleen 6, CV4. Liver 8 is the water point, the Hussey point. Spleen 6, 3-leg yin. CV4 is a good kidney point. Stomach 36. Oh, look at that. Stomach 36 and spleen 6. If there's blood deficiency, which this pattern is talking about. Kidney 3, if there's a lot of signs of kidney issues. Kidney 6, if there's more kidney yin symptoms, because kidney 6 is like the quintessential yin point for the kidneys. And then if they have a lot of night sweats or insomnia, you could add heart 7 plus kidney 6. Those are just a combo that you see quite often for insomnia or night sweats. So this is it's commonly seen in women in their late 30s through 40s and into their 50s. If seen in age of menstruation, may see early menstruation, erratic menstruation, or flooding or leaking. Basically, it's perimenopausal symptoms, menopausal. That's why I was saying 30s, late 30s through 40s and into their 50s. And then if seen in ages of menstruation, you may see some erratic menstruation because of that liver flooding or leaking, meaning too much coming out at one time, heavy flow, or um, where people spot. Once again, that goes back to the liver. Go to heat in the blood too, but the reason they mention that here is because of the liver and how it manages the distribution of blood. All right, guys, I'm going to stop here for today, and then I will continue this at a different time. I hope this has been beneficial. Like, subscribe to the channel, and next time I see you, we'll be on part 3. Okay, thanks.